6 a.m. but she still feels.
Let me sleep a little more. Then it's 7:30, 8, 9, 9:30, and she's still in bed. Mommy comes, knocks at the door. Mommy enters the room. What are you still doing in bed?
I'm feeling weak. I don't think I can get up to do anything. I just want to rest.
Aren't you gonna do anything today?
Me, I'm tired. I need to rest. Leave me, let me rest a little.
That's a common complaint of many people these days. Weakness, dizziness, fainting spells, headaches, tiredness. There are various causes of these. However, commonest we find is low blood pressure.
Is there anything like low blood pressure?
Yes, there is. Just as blood pressure can be high, blood pressure can also be low. Coming up. In this video, I'll be sharing with you 10 causes of low blood pressure. Coming up. Before we can talk about the abnormal, we must first understand the normal. So the question is, what is normal blood pressure? Normal blood pressure is defined as a blood pressure where the systolic pressure is between 100 to 139 and diastolic pressure is between 60 to 90 millimeters of mercury. Whenever blood pressure is within this range, it is regarded as normal. However, there are variations based on age within this gap. If the blood pressure is above 139, that is 140 and above, it is regarded as hypertension, which is beyond the scope of this video today. But if the blood pressure is below 100, sometimes you can see in some materials they say 90, but here in Africa and in Nigeria we use 100. If it's below 100, it is regarded as low blood pressure. That is, if the systolic is below 100 and the diastolic is below 60, it is regarded as low blood pressure. Low blood pressure is also regarded as hypotension. So when it's high, it's hypertension. When it's low, it's hypotension. Having discussed what normal blood pressure is, the next thing is,
what are the causes of low blood pressure? Number one, prolonged bed rest.
people, they are weak, but
They always want to be in bed. You're in bed, you're pressing your phone, you're reading a book, you don't get out of bed, you're just lying down.
you're not sleeping, you're lying down. Sometimes you spend most of your time in bed, especially those that don't go to work. That kind of lifestyle will make your heart lazy. Lazy heart will not be able to generate good pressure, because the blood pressure is the pressure with which the heart pumps blood. The blood pressure is generated primarily by the heart. The healthy heart will generate healthy pressure. So prolonged bed rest
Makes the heart
weak and unhealthy, and thus reducing the pressure produced. Number two is the brother to number one, which is sedentary lifestyle. People that are always sedentary. You go to the office, you sit down. You're in your car, you're seated. You're in your house, you're sitting down. Office to car to house, all through you've been sitting down. You are not active. A sedentary lifestyle like that will predispose you to low blood pressure or high blood pressure too. 3 is poor health-seeking behavior. Come closer, ladies. This is for you. Every lady bleeds every month. You lose some amount of blood. That is why the cell volume of men is universally higher than women. For every woman, she is supposed to be consciously replacing that lost blood during every month. She's supposed to be consciously replacing it through her meals or through supplements, through blood supplements. But most women don't take that, so they keep losing blood without replacing it. 6 months, 1 year down the line, they become hypotensive. Their blood pressure starts dropping because their blood volume is reducing. And as the blood volume reduces, it reduces the blood pressure. That causes them to now begin to feel dizzy. They have headaches. They have fainting spells like they want to collapse. Sometimes they feel weak, weakness, general body weakness. All these may be signs of a low blood pressure. So for ladies, always make sure you're taking blood supplements every month to replace the blood you lose. It's protein-rich diet. Take blood supplements like iron, folic acid, or help boost your blood level so that it compensates for the amount of blood you're losing. Number 4 is medications. Some medications have been known to reduce blood pressure, especially the most common ones are antihypertensives. They are known to reduce blood pressure. So a person on antihypertensive can come down with low blood pressure. And in that case, what do? You go to your doctor, and your doctor will tell you what to do. 5 is pregnancy. Pregnancy normally reduces blood pressure. So in pregnancy, blood pressure is expected to drop, not increase. So if your blood pressure increases in pregnancy, it is regarded as abnormal universally. If your blood pressure reduces, it is expected, it is normal. However, the blood pressure is not supposed to go lower than at least 10 millimeters mercury of the systolic of the normal blood pressure of that woman, which means if her blood pressure before pregnancy was, let's say, 120/80, in pregnancy it's not supposed to go below 10 to 20 millimeter mercury less than her normal blood pressure. So it's not supposed to go below 110 or 100. Below 100 to 110 millimeter mercury for that woman. In pregnancy, blood pressure is expected to reduce. 6. People who have lean body, people who are slim in nature, people who are slender, generally will have low blood pressure. Their blood pressure will either be within normal range or be slightly lower. They live normally with it, they cope with it. A lean body mass can lead to a low blood pressure. And also, fat person is expected to have a higher blood pressure. Next is dehydration. Dehydration. Many of us, it's like we're quarreling with water. Drink water. No, I'm full. I took water. But you just took one glass. Drink water. You say, no, I don't want too much water. Legend fella, he sang a song. Water. You don't get enemy. Water does not have enemy. You can drink as much water as you want. Drink water. Person who is dehydrated will tend to have a low blood pressure compared to the one who is hydrated. So drink water. Your body needs water more than even food. It can cope, can survive better with water than even food. Research shows that without water, somebody can only survive about 4 days. But without food, people can survive up to 3 weeks, up to a month without food. So water is very, 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 very essential. Drink water. Drink as much water as possible. At least 3 liters of water a day is normal for every adult. So if you're 18 years and above, you're an adult. And for adults, you should be drinking at least 3 liters of water. You know that Eva bottle? That Eva bottle. That is 1.5 liters, the big one. Every adult should drink at least 2 of these. You should finish at least 2 of these every day. Every day you should finish at least 2 of these. If you can finish more than 2, fine. Because some days you lose more water. Like this period that is heat wave is so serious, so you can lose much water. So you can drink more of this, but at least 2 bottles of this you should finish every day. Drink water. Drink as much water as you need. Easy way I tell my patients to check whether your body water level is adequate is the color of your urine. If your urine looks like water, is colorless like water, then you are well hydrated. However, if your urine is yellow like Lipton tea, it means that you are not well hydrated. You are dehydrated. So drink water. Drink water. Oh. Now go and drink water now. Go and drink water. Yes. Now you can drink water. Sometimes a low blood pressure could be normal for those who are fit, those who are active, athletes, those who are healthy. It could be normal for them, which means an athlete, a footballer, or a runner, or person who does exercise regularly, who is fit, who has a fit heart, sometimes can have a low blood pressure. And that is normal for such a person because the heart muscles are healthy and they are pumping. They don't need a high pressure to do their work. So they maintain at that pressure, and which is normal for the person. So a healthy heart can sometimes perform better and the person will be perfectly fine. So sometimes you can expect that in athletes, you check their blood pressure and their blood pressure is less than 100. You don't bother about it because they are active. So when you're active, for those that are active, their pulse rate will be lower than the expected. Their blood pressure too will be lower than the expected, and they don't have any problems. So Mary, start to be active, start to exercise, work out, exercise. Your heart muscles get strength. As you exercise, your heart is forced to work and to pump blood to your muscles, and that strengthens your heart. The heart works, those muscles become developed, and as they develop, their function improves. So Mary, start to exercise. Julius, start to exercise. Don't play with your fitness. Don't play with exercising. 9. Sometimes a low blood pressure could be genetic. Low blood pressure could be genetic. Come closer. If your blood pressure is low, find out your parents, what is their blood pressure like. Sometimes as a lady, your mommy's blood pressure could also be low. Be a genetic trait that for the ladies, their blood pressure is usually low. And in that case, it could be normal for such a person. The final cause is sometimes we scientists, we doctors, we don't know what is the cause. Sometimes a low blood pressure could just be there in existence without any known cause. Important for me to add that the treatment of a low blood pressure is usually to find out the cause. When you find out the cause, then you can easily treat it. So if you notice your blood pressure is low, go see your doctor. Your doctor will ask you some questions, and from there he will know how to best help you. If you like contents like this, do well to smash this like button so that I know that you love my content, and do well to subscribe to this channel so that when I post a video, you will be the first person to know. And I'll see you in my next video. Click on this video showing by the side.